On top inside Edo today, Edo state government don't ban street trading for Edo and dem go soon begin house-to-house testing. Edo state government don't ban street trading for Edo state make dem for fit control coronavirus disease for the state and make it for easy for people to fit practice social distancing and make COVID-19 for reduce for Edo state. Edo State Deputy Governor wey still be the chairman on top Edo State Task Force for COVID-19, Right Honourable Comrade Philip Shaibu, na im talk this one for press brief wey shele for Edo State Government House of Benin City.
Mr. Governor has been on top of all the issues and he has been leading all the discussion and all the approvals and programs of the COVID-19 response teams in Edo State. Flowing from our discussion so far and some things that we have observed, we have taken some decisions that we need you to know and Edo people to know. Also, Mr. Governor will be having another broadcast tomorrow to also emphasize some of those issues that we have also agreed that we should do to stop the spread of COVID-19 in Edo State.
Im tok say Edo state government dey do this one so that Edo people go fit practice social distancing and other things wey go stop COVID-19 for the state. Shaibu still tok say Edo state government get more plans to put for ground to make sure say Edo people dey obey the law.
Another directive to check the compliance to social distancing. Another directive to check spread of coronavirus COVID-19. The Edo state government is working out more stringent measures to ensure total compliance. As part of these measures, we hereby announce the ban on street trading to restrict contacts among people and enforce social distancing. This is in light of the fact that market has been moved to public and primary schools premises to facilitate trading in essential commodities such as foods and medicine.
Edo Deputy Governor tok say government don put screening centers for Oredo local government area for Edo State, and 6 of these screening centers na primary healthcare centers and the remaining 4 na private hospital. This one follow for say dem wan screen 500,000 people and test 5,000 people for the state. Make una sabi say all this one go start for other local government areas for Edo State very soon.
We have set up screening centers across the state. We are starting with Oredo local government. We've set up screening areas starting with 6 primary health centers in Oredo local government and 4 private hospitals as screening centers, making a total of 10 screening centers in Oredo local government to actualize our plan to screen 500,000 persons with the ultimate goal of actually testing 5,000 persons. This practice will also help us to scale up the screening of others in various local governments. We are aware that about 5 local governments are key to the spread of COVID-19 in Edo State. So far, with our data, we have about 12 local governments that we are focused on. Our target is to have at least 500,000 persons screened to achieve at least 5,000 testing.
Representative of WHO come tok say that they do better contact tracing for Edo State and say the 15 cases wey dey Edo so na returnees and people wey be go state wey coronavirus don dey well.
We've been contact tracing since the outbreak. Once there is a confirmed case, we followed up all the contacts. We try and list them and follow them up for 14 days. We have 15 cases, confirmed cases in Edo. The last time we spoke, I think they were far less than that. So it's real. So the 15 cases we have now is either they are returnees from abroad or they travel from Lagos or from Abuja. And like I said, about 3 had contact with those confirmed cases.
Edo State Commissioner for Health Patrick Okundiayan say Edo State Governor Godwin Obaseki don already sign and make them begin house-to-house testing on top coronavirus disease for Edo State.
The government has decided that we need to encourage screening As part of that effort, the target is to screen at least 500,000 Edo indigenes cut across the 18 local government areas. But we started with a pilot local government area of Oredo. Today, we have 10 centers for screening. For the purpose of screening, 6 of them are within the primary health care and 4 from the private health care facilities. The first is Arogba Primary Health Care Center in Oredo local government area. We have Oko Primary Health Care Center. We have Ugbo Primary Health Care Center. We have Oredo Primary Health Care Center. We have the New Bini Primary Health Care Center and the Ikpeme Primary Health Care Center. On the list of private health facilities in Oredo, we have the Faith Mediplex. We have St. Philomena Hospital. We have Betterfield Faith Hospital. And we have Safe Haven Hospital. In addition to these screening exercises, the governor has also approved the mobile screening, wherein healthcare workers will be moving from places to places, house to house, market to market, so that we can catch any of our persons who may be having this disease without knowing it. A new isolation center, a state-of-the-art, in line with global best practices, with state-of-the-art equipment from foundation to completion, took the Edo State government 12 days. As we speak, we have a facility called the COVID-19 Isolation Center standing firmly at the Stella Obasanjo Hospital. It is a 30-bedded isolation center and boasts of all the facilities that you can compare to the best centers in the world. These measures are very important so that we can prevent what we call community spread of this disease.
Now here we see this ogbonge informate reach on top inside Edo today. As Edo state government don ban street trading for Edo and dem go soon begin house-to-house testing. Make una sabi say na T Live Media and I carry this ogbonge informate come give for now.